Pulmonary tuberculosis, management and treatment. Introduction. Tuberculosis, TB, is considered one of the oldest contagious diseases. As of 2010, the World Health Organization estimated that there were 8.8 million people infected. The disease has definite clinical manifestations such as productive cough with or without hemoptysis, fevers, night sweats, and weight loss. The patient from the case study experienced most of the symptoms and was taken to the hospital after 1 week of observing these symptoms. Complex examination proved the diagnosis of infiltrative TB of the left lung without MBT shedding. Case study. A 30-year-old male who looks older than he is has a history of intravenous drug abuse and hepatitis B. Clinical manifestations. The patient was admitted to the hospital, where he was examined by a physician in an emergency room. Vital signs such as blood pressure and respiratory rate were within the normal limits. However, the temperature and heart rate were higher, 38.0 degrees Celsius and 110 breaths per minute. The patient looked depressed. A check of the respiratory system revealed unilateral, left side, crepitation. The clinical manifestations suggested a high probability of TB. Diagnostic studies. The laboratory studies revealed 1.8 creatinine, WBC, 9.48 times 109/L, and hemoglobin, 11.4 gram per deciliters, 114 gram per liters. HIV test is negative. Radiological investigation revealed infiltrate in the middle of left lung. It was 1.7 centimeters in diameter and showed signs of cavitation. Microbiological investigation did not show growth of blood culture. Mycobacteria growth indicator tube is also negative. Sputum smear showed 4+ squamous epithelial cells, 1+ segmented neutrophils, but no organisms. Clinical management and treatment modalities. The initial treatment consisted of 2 stages. The first one lasted for 8 weeks with 8 prescribed antibiotics, and the second one was supposed to last 24 weeks with 2 prescribed medications. Evaluation of treatments. The treatment was not efficient, and the patient returned to the hospital after 2 months, complaining about coughing up blood. Also, he had been still experiencing malaise, night sweats, and weight loss. Another chest X-ray discovered progressive bilateral fibrinodular disease with a military pattern. The medications for the following 20 months included levofloxacin, cycloserine, kanamycin, pyrazinamide, and prothionamide. Patient education and safety. Patient education and safety interventions are based on the objectives of quality and safety education for nurses and include patient-centered care, preventive strategies aimed first of all at the representatives of risk groups, etc. Apart from smoking and drug and alcohol abuse, risk factors for TB are HIV and AIDS. Also, malnourishment, diabetes, some types of cancer, and kidney disease contribute to getting TB. In addition, the prevention of TB includes limiting contact with infected people.